Welcome to this podcast from the Christie Hospital, Manchester, one of a series of podcasts for our PlanBe programme. PlanBe is a holistic programme for people living with cancer. It helps to improve, nurture and sustain health and well-being through natural means, diet, exercise, complementary therapy and activities to boost resilience, mind and spirit. PlanBe was developed in partnership with Macmillan and Manchester Cancer.
Welcome. I'm very pleased to have this podcast today on complementary therapy. And with me I have Ian, who's a patient of mine, and also Peter Mackereth, who is the lead of the complementary therapy team at the Christie Hospital. And we're going to be talking today about complementary therapy and how that might help people who are living with cancer. And we'll start with you, if you don't mind, Ian. If you tell us a little bit about your story and take us back to when you were first diagnosed with cancer.
Okay, thank you. It was probably about 12 months ago when I started with a chesty cough and process of going to the hospital with Insure and ultimately coming to Christie, I was diagnosed with a chondrosarcoma. And obviously it was a shock to the system, having been, I consider, quite a healthy person, keeping myself mentally fit and physically fit. And then I'm told that because of where it is attached, it's attached to my 12th rib and also my diaphragm on the left side at the back. I'm told that it's inoperable because of the chances of taking some of the diaphragm away, and the treatment part of it was chemotherapy, which I was told originally it was possibly chemotherapy. But I'm now told that there's probably only a 10% chance of that having any effect. And I was advised that because of the quality of life that I had and have, to probably keep on with the quality of life that I've got, which a quality of life for 12 months to 2 years, and then probably it would deteriorate for 5 to 10 years. How I'm dealing with it is I'm keeping myself very busy, obviously around the family, friends. I had my own little business. I was a police officer for 30 years. I retired 13 years ago. I started my own little business working for solicitors, putting cases together for defence cases, visiting people, interviewing people. I'd stopped that for quite some time because of how I was and how I felt, but I'm back doing that now. I'm the secretary of a golf club and I find that very therapeutic. People are aware of my situation. I've not hidden the fact that I've got cancer, and because I don't want people to be afraid to come up and speak to me. I find that helpful. Having a good family around you and good friends, for me, is one of the biggest things that you can have. I'm mentally fit, I feel, and physically fit. I have a good appetite. I've not started losing weight, and I say started there, perhaps that's not the right phrase, but I'm not losing weight, I'm maintaining my weight, because I know that 1 or 2 people have said, oh, we've expected to see you've lost weight, as you expect, I suppose, but whether that comes with the chemotherapy, radiotherapy, I don't know, because I've not experienced that. I'm on 3 monthly visits to see Dr. Leahy, who told me last time that it was an indolent sarcoma, and that he was pleased with how I was. I was stable, and that's how I feel. Albeit I have a couple of off days. Yesterday I did something probably that I shouldn't have done, lifting something heavy, and I suffered for it overnight. But the medication that I'm taking is paracetamol or codeine, and I'm dealing with it that way. And hopefully I can maintain and beat this 12 months to 2 years quality of life. I intend to be here for a lot longer than 5 to 10 years as well, if I can.
And one of the things that's really impressed me about you, Ian, is that you've really kept yourself well, haven't you?
Yes.
You've looked after yourself.
Yes.
And have you adjusted the way that you look after yourself at all since you've had your diagnosis?
I suppose slightly, because I've realised that I used to play golf 7 days a week, and I can't do that now. I played golf last Wednesday and suffered on Thursday and Friday. It wasn't a particularly good day, and I didn't feel brilliant to start off with. So I've cut my cloth accordingly, so to speak. I have cut back, and just realising that, you know, my body will tell me when it's right to do things and it's when it's right not to do things.
And we're here to talk about complementary therapy. Is that something you've ever thought that you might try?
Not really, no. Not really, no.
Because we discussed in the clinic how maybe chemotherapy might not be much help to you.
Yes.
I wondered if you perhaps had explored other things that you might try yourself.
No, of course I came along to that, the guinea pig session for Plan
B.
PlanBe, I was going to say Plan 4B, I'm sorry, Plan B. And there was some treatments and therapies within there that I'd never heard of, albeit others had. I must admit, we've always been churchgoers to a degree, but not of a religious or family. Albeit we do go to church, and that's been a benefit as well, because I know that people there have been praying for me, so that's been a help. And it's just the fact of my friendship and the family, they're my biggest therapy for me. I wouldn't say no if there was something that probably someone else would say, oh well, this worked for me. I wouldn't say no. I'd give it a bit of thought.
So for you, what other patients say and their stories would actually be quite a powerful
Certainly.
thing. Yeah,
Certainly.
that's interesting.
Yeah.
Well, we'll turn to Peter now and hear a little bit about complementary therapy, and we'll come back to you later and see what your reactions are to what Peter says. So Peter, welcome. I'm really pleased to be able to talk to you today. You're a central figure at the Christie Hospital, and you are a nurse by training.
Indeed.
But also have a PhD, so you're a doctor as well.
Yes, in research related to my practice.
And you are the lead for the rehabilitation and complementary therapy team here, aren't you?
Indeed, yes.
Yes. And I have a very long CV doing research into this area, so I'm fascinated to hear how all of that came about. How did you get into complementary therapy?
Well, I trained as a nurse originally and worked in critical care and also worked in neuro as well. So I got interested in providing complementary therapies from my own journey as a patient too, with living with stress, etc. related to work. So I looked at therapies such as massage and Tai Chi for myself, and then via sort of a circuitous route ended up training in various therapies. And in the 90s, I started running a small clinic for people affected by AIDS and HIV and doing massage and aromatherapy, and it sort of took off. And then in my own practice in intensive care, I got asked by a consultant would I do some work around a condition called Guillain-Barré syndrome and doing massage for them as they were recovering. And then my journey of doing a PhD was working with people with MS. And I was challenged by a doctor that said to me, well, things like reflexo massage, they're no more than a relaxation technique. So I ended up investigating and comparing reflexology with relaxation and doing a trial and measuring things like stress hormones and stuff like that. And then about 15 years ago, I saw this job advertised here for Christie's, which was developing a team of complementary therapists, and was successful at interview. And over the 15 years, we've grown from myself and one other part-timer to a team of about 35 therapists. They all work, most of them work part-time, and we work on the wards, we work in clinics. We've also developed a role in helping people manage to go smoke-free and also doing work around healthy living in terms of alcohol, moderating alcohol use, etc. So we provide things like relaxation classes. We help people with hypnotherapy techniques to help them before maybe a procedure. So some of our patients might be experiencing needle phobia or claustrophobia related to having scans. And so we get involved in helping them through those procedures. And we do a fair bit of acupuncture to help with very specific symptoms. And some of those areas of work we've actually done some evaluation and studies with. So fatigue is one thing that I know a lot of patients experience, and insomnia. And also, I say anxiety before medical procedures. So we've done some evaluation projects and got those published. We've got a study running at the moment with altered sensation in the hands and feet. It's called peripheral neuropathy and can often be related to certain chemotherapies. And we're doing a study at the moment using acupuncture to help ease that symptom really and improve the sensation in the hands and fingers. So it's early days with that project.
So you're somebody who obviously likes to bring scientific clinical trial methodology to the arena of complementary therapy. It's fascinating. If we take a step back and ask the question, what is complementary therapy? How do you define what is a complementary therapy? What would you say?
Well, if we did an A to Z, it would cover the walls really with
Yes.
lots of different terms, because there's many out there. Some of them verge on the alternative, so we have to be careful when we talk about words, because the word complementary in my books is about what sits comfortably with conventional medicine, and also where is the evidence for what we do. Alternative tends to be something that's opposite to an alternative choice, really, if you like, and those modalities sometimes don't always have the evidence base that we would be looking for. It's also about the claims, because what we aim to do is improve well-being. If there's one symptom that we have evidence for, and that's anxiety, and of course if you put anxiety on a flip chart and put all the other symptoms that people experience going through a cancer journey, then if we can reduce anxiety and improve well-being, then sometimes those symptoms can be eased. And so most of our techniques are about doing that. Interestingly, some of the techniques that we do, particularly the acupuncture, probably veers more towards the alternative, in terms of we're actually looking at some very specific symptoms and seeing if they can be helped by acupuncture. So for example, nausea, insomnia, and this condition we talked about earlier, peripheral neuropathy, where I think modern medicine sometimes struggles with finding help with those symptoms. So yeah.
So something like, for example, homeopathy, would we call that a complementary therapy?
I would probably use the word alternative to describe that, really.
Right.
And it's not something we offer here at the Trust. Patients do use it in the community. There is a lot of debate out there about the efficacy of homeopathy. So I think when it comes to limited resources, then we need to look at what we can provide, that there's evidence out there that we can think that we can help to improve. And I say anxiety, well-being are things that we're good at helping with.
And you've looked into the evidence behind quite a lot of these therapies.
Yeah, it's really because, again, we have a limited budget, so we have to think how we can spend it, and we also need to find out what do patients want. And the evidence that I have from surveys, etc., is things like massage, relaxation, aromatherapy, hypnotherapy appear to be very popular with patients. Acupuncture too and it's also the therapies that have a wider acceptance. So acupuncture is often delivered by physios and doctors, and dentists. So it's that seems to have greater acceptance. And I suppose when you're knocking on the door to have greater integration of therapies, you actually need to find therapies that are going to have greater acceptance.
That's interesting. So there are things that people find easier to accept, and maybe things that they find harder. And then there is that dimension of how much evidence there is. What about the sort of proposed mechanism of action about how these therapies work? I mean, you've talked about how a lot of it could be through anxiety reduction, but obviously many of them at least suggest that they are working through, I don't know, energy levels or energy meridians.
Well, if we take
in the body.
acupuncture, obviously there's a traditional Chinese medicine view that it's qi that's being moved, if you like,
yes.
and there's different elements they talk about, heat and wind and damp in the body. While of course if you take a medical view on acupuncture, then we're often talking about a biochemical response to needling, where there's release of things like serotonins and dopamines and endorphins, and there's some evidence from assaying blood or from scans to show that something's happening in the body when you're needling people. When you're looking at things like massage, relaxation, then you can perhaps go down the sort of route of looking at a concept in stress, which is called psychoneuroimmunology, where effects on the well-being of the person appears to have an effect on the immune system. So in my own PhD, I looked at cortisol, which is a stress hormone. And what we know with cortisol, if it's high levels of it in the body, which can often occur when you're very, very stressed, is that it can have a knock-on effect on lots of things that go on in the body. For example, the immune system. We know that a high cortisol can damage natural killer cells, which we need. And that you're kept in when you've got high cortisol levels, you're in a state of alert. So things like healing of your skin, digestion, all of those things can be affected. So if we can bring cortisol down, I mean, it goes up and down during the day anyway, and that's fine, but we don't want it up all the time. We want it to modulate and come down. Then those sort of physical things can be improved, really.
So what you're saying is maybe it doesn't really matter if we know how something works. If it can have an effect even through anxiety reduction, it can have a physical effect as well.
Yeah. I mean, I literally see people who are, say, very, very needle phobic. You know, if you take their blood pressure, that may well be high. They're going to have a dry mouth. They're going to be frightened. They're going to be anxious. It's going to be difficult to locate a vein because that's all shut down because they're in there. So it's affecting how they proceed through their treatment, because if you can't get a needle in to deliver the chemotherapy, then you then are stuck. You've got to think about another route, and maybe having a line put in a main blood vessel, which is quite a procedure in itself, so you want to try and avoid that. But also you've got somebody who's very, very stressed out, and if they're very stressed out, then obviously that's going to exhaust them and make it harder for them. And we want them to have a much easier journey through cancer treatment, which would be my goal.
And even for many of the medical therapies that we offer, we sometimes don't really know how they work either. And I think that this is something that people don't always understand when they're thinking about a complementary therapy. They see modern medicine as being scientific and maybe complementary therapy as being unscientific, but actually it's a much more blurred distinction, and there is evidence that shows that there are complementary therapies that have real physical effects. And there are some medical therapies where the evidence may be fairly minor that they help anybody. So that's why I think we're interested in patients who can look for complementary therapies themselves. So if you were in Ian's position, Peter, do you think that you'd be thinking about a complementary therapy that Ian could incorporate into his daily life as part of his way of managing cancer?
I think it's interesting looking at our services that when we look at the gender of those that use it, we predominantly have more women than men use the service. And I sort of ask questions as to whether or not men have a different way of coping or have particular different interests.
Or is it a macho?
Yeah, exactly. About whether or not we sort of try and cover the anxiety and the stress, and whether that manifests in different ways. So we sometimes get men that come to our service, they come with very physical reasons. So they'll say, I've got a backache, I've got a neck ache, I've got headaches. We do get some men that come to our service who have side effects of some of the treatments. So gentlemen who've had prostate cancer, and they may well have had medication that would give them things like hot flushes, female hormones that might give them hot flushes, and we might provide acupuncture for that. There can be a gender issue around complementary therapies. What's interesting is that once some of our male patients have been exposed to complementary therapies, they really enjoy it. So, it's that stepping into it, really. When I listen to your story, it sounds to me like you are doing lots of things to keep yourself well, and I think that's an important part of any assessment I might do with someone. I might want to say, well, how's your exercise, how's your eating, and how's your fatigue levels, how's your sleep. So I'd want to get what we call a holistic assessment of your daily living and how it's affecting you. I might also be interested in your family.
Yes.
In terms of how I might support them, because sometimes we think just of the patient.
No, well, that's
you,
right.
You know, it might be
That's
that you
right.
have a partner,
children
that are struggling with the
diagnosis,
and dad's being very brave.
That's right.
You know, but they're struggling with the future. So we provide services also for family members.
Yes.
And we have drop-ins and relaxation classes that they can attend.
Yeah.
And sometimes they just want to talk to someone.
Exactly, that's right. Yeah. It's interesting about the fatigue that you were saying, because if anything has happened to me, but is it because of age? I'm 63 now, so because I know that a friend of ours not so long ago said, "Oh, I'm getting very tired in the afternoon." And oh, thank goodness for that. I thought it was just me, but I get tired, and I could fall asleep. I'm one that tries not to. But because I don't sleep well at night time, I've always never slept well.
Right.
So because you said about the sleep patterns and so forth, I've always never slept well.
Yeah.
But it'd be interesting to, when you say about the acupuncture particularly, do you go into the site there with the acupuncture?
No, we would use certain points in the body that may be away from the site of the cancer.
Right. Yeah.
There are sort of specific points in the body that we needle, that we know from the research work that we've done and others have done. So there's almost like a recipe, if you like, of points. So we have a selection of them. So for example, with fatigue, we did an RCT, a randomized controlled trial, and needled people very specific areas. We also taught them how to needle themselves. So some of the people in this study actually got to learn how to do acupuncture, and we measured fatigue scores, and we had an improvement. So, and there was a knock-on effect on things like memory, because sometimes if you're tired, words don't come out.
Oh yes.
And you start to question. Have I got is this early dementia?
Exactly. That's
and
right.
in fact, fatigue is number one reported symptom for patients across. I mean, I meet it all the time.
Yes.
And it's not the sort of tiredness that goes away from having a little doze or a night's sleep. It's there in the morning.
Yes, it is. Yeah. This morning I could have slept in. I didn't do. I could have done in the end, because of course where I went this morning didn't happen, and I felt better this morning forcing myself to get up.
Yes.
Because you've got something to, you've got a goal. Whereas if with not doing much work, I'm just getting up and doing things, pottering around at the golf club or wherever, and I do get tired when I've got nothing to do.
And the evidence is that graduated exercise is good. And because our service is complementary health and well-being, we encourage people to do.
That's what I've been told.
Gentle exercise. So you find a way of working with that. Yeah. So that's good. And also, you were talking earlier about eating. We would also recommend smaller meals, more frequent, rather than a heavy meal, because often if your body's trying to digest a big meal, then you're going to be tired from that. And so having small meals often is another good thing.
Right.
And doing something like a relaxation exercise. So we run classes, we teach people to do mindfulness sessions themselves, or a simple relaxation exercise, so that they take a little bit of time out of their day. And the relaxation exercise is quite physical that we teach. So it involves tightening and releasing muscles of the body in a pattern.
Pilates types.
It's a bit like that, yeah. So a little bit of stretching and then releasing over about 20 minutes, half an hour. And what I know, having researched this myself, is that the stress hormone cortisol that I've talked about before comes down from doing this as a regular part of your routine.
Yes. I do feel as though the stress, if there's any stress there, it's when I'm on my own. At home particularly, because forgive me for saying this, all the adverts or every other advert on the television is cancer research.
Seems like that, doesn't it?
Yes, and not that it shouldn't be, but when you sat there, and you're in your own four walls and you're thinking, goodness me.
And you've got nothing to distract you.
That's right. I mean, because I don't read. I don't read at all. If it's sports, I'll sit and watch sport all day. But yes, it's virtually every other advert is cancer research. But I know Dr. Leahy said to me about exercise, 30 minutes
3 or 4 times a week?
Yeah, yeah.
Well done,
And
yes.
we could do it every day of the week. Every day of the week. I said I'd like to get back into running if I could, but it's just a little bit sore at times.
Yeah.
But you know, it's. I've been swimming. We've been to, my sister has a gym, so I go to the gym and use the pool. We've been on the machine, so I do, and I want to keep myself active.
And sometimes it's about looking at what you do in your life and sort of say, well, you do that, and that can make a difference. So for example, what we know is humour can help.
Yes, yes.
You know, a good chortle.
Oh yes.
Watching your favourite comedy.
Oh well.
That can bring your cortisol
Massively,
down. So
massively.
it's reminding ourselves, and you've said it yourself, spending time with your family, going to the church, all that. There is evidence for prayer, interestingly enough, because prayer has quite a meditative element to it. But there's also some evidence to say that other people praying for you is valuable too.
Yes.
That sense of being cared about.
Yes.
So there are a lot of things that we do in our lives that we can sort of monopolise, or go, right, do that and I do that, and eating healthily and all of those sort of things are useful too, and moderation, but having fun.
Yeah, well, that's humour, as you say, is one of the biggest ones.
In the States, there's a group called Spunky Survivors, which is about, in the week they're a little bit more sort of careful with their diet. But at the weekend they're a bit naughty and they do some fun things. So it's keeping that balance in life. So it's not all hard work.
It's in moderation.
Absolutely.
Moderation. Yeah.
Part of the thing about having a complementary therapy is taking care of yourself, isn't it? It's being kind to yourself.
Yes.
And I think that's a very important thing that we encourage for patients who are going to be adopting this Plan B, is that it starts by saying, I'm going to look after myself, I'm going to take care of myself.
Yes.
So in Ian's case, Peter, or in a person like Ian's, who were thinking maybe a complementary therapy might be something that I'd like to try, how would they go about finding a complementary therapist? Because you're a very special resource at Christie, and not everybody can come to see you, unfortunately.
I mean, it is around the Greater Manchester area. If we take that, there are a number of centres, complementary therapy, cancer care centres, and as a service, because obviously we can't see everybody, we'd often signpost people to those services and introduce them to groups or give them the contact details so they can go somewhere locally. So there's that. I mean, obviously you can go privately to see people, but that's expensive. You don't always know how skilled these people are. What we do know is that people who work out of cancer care centres and hospices and community complementary therapy teams that may have a charitable base, is that those staff will have been reviewed in terms of their training, their insurance. So those sort of things I know I'm looking for if I'm recruiting a therapist into my team. I need to know whether they've got appropriate training, insurance.
I think these are the important points, aren't they, for them all, for all the therapies.
Yeah, and they're not making outlandish claims for what they do.
Yes.
I mean, you can go on the internet and find all sorts of weird and wonderful therapies, and people making all sorts of claims. I can cure this with this magic pill, and I think we have to be so careful, because people are out there looking for something and they're quite vulnerable.
Yes.
So is that like a warning flag, do you think, Peter, if you see people making claims which are maybe not verifiable and rather over-optimistic? Do you think that's a bit of a warning sign that maybe you should steer clear of that?
Yeah, I think so. I think be careful, because obviously you're a consumer.
I can guarantee. That's that.
Yeah.
It doesn't work, does it?
No.
So going through your local hospice, they may have practitioners that work for them. Are there guilds or associations that you can look for licensed practitioners?
I mean,
does that work?
If you've done a training in a complementary therapy, you can usually register as qualified in that therapy. Most of the therapies that are offered in this country are not statutorily regulated like nurses and doctors and physios are, but they are voluntary regulations. So there will be groups that support them. There will be professional bodies that support them, and they will hold a register. And those to hold beyond that register, you have to demonstrate that you keep up to date with your practice. That you've done a certain length of training, etc. So there are some verifying points that are useful. So I would look for that for a start. That's a good place to start, is to look at some of these sites.
Are there any publications within the Christie?
There are. We in the information centre they hold brochures about the therapies we offer here, with a little definition of each of those therapies, and the centres that are around the Greater Manchester area, their booklets on most of those, and I tend to be asked to look at those, to have a little look about what they say. So to speak, and we've had one or two odd things that have come my way with outlandish claims, and I said, well, no, let's not go for that. And, so we have those brochures of those centres that have a good reputation.
Right.
Mm-hmm. So what do you think, Ian, after hearing that? Does that spark your interest at all in something that you might do for yourself?
It has. I think I'd probably like to look into it a little bit more as well, but because it's if you do, it's the devil in the deep blue sea, isn't it? If you do, and how do you know whether it's going to...
And you can sample these things. So, for example, we have drop-ins that happen on a Tuesday and a Thursday. You don't have to book. You can simply arrive. You can watch the treatments being given because it's in an open room, or you can sit in on a relaxation class. There's no... forcing you into anything. You can observe and experience it if you so want. And those occur on a Tuesday and Thursday, and also on a Wednesday afternoon. Right. And it's one way of sampling.
Yes, I think it is something that I'd consider. Yeah, I'm not looking at Jill just there, just in case she's shaking her head or whatever.
She's nodding.
Oh, yeah, she's happy. She's happy. So.
And we often say to people to bring a partner or a family friend, because we provide services to them as well. They're very, very important to us because, as I say, they're standing by you, they're witnessing what's going on.
They're living with cancer.
Exactly. And I think they need to be supported, because what we know is that carers often, their health can be affected.
Immensely, it must be.
They do a lot of worrying sometimes.
Without showing.
Yeah, because they've got to be strong for you.
Yes.
Do you think, apart from what we were talking about of maybe practitioners who are maybe not entirely ethical about their practice, but do you think there are any other possible downsides to engaging in a complementary therapy? What do you think about that, Peter?
I think it's about expectations sometimes. I think people will, we sometimes get people who are quite far on in their journey and are arrive thinking that, well, maybe if I have acupuncture, that will stop the cancer growing. I'll be fine. Yeah. And you have to be so careful about those, because we set our store out, which is, this is how we think it can help, and we have a certain amount of evidence to suggest this helps. We certainly do come across patients who are regular attenders who say things like, this really makes a difference, I look forward to it, I come here once a week to say have acupuncture or massage, and it just lifts me up and it keeps me going, it helps my resilience, if you like. And they'll actually say to us, well, I think it's really made a difference to my longevity, if you like, as a patient, and then it's improved that. But we can't make those claims, because we don't have the evidence on longevity.
Yeah, no, quite.
But if someone is saying they feel stronger, they feel more resilient, then that's a good thing.
Yes.
In our books. So.
Yeah.
What about you, Ian? Have you felt some kind of reluctance to look into these things?
I think I have.
And what's been your hesitation?
I think before this, it's not the macho thing, but I think it's a case of, well, I can deal with this. I've been told how to deal with it myself, and not impinge on the family too much. So it's probably that it's just, and probably the unknown factor as well. That, how do I go about finding about it, and what effect will it have? But it's something that I would certainly consider now. Definitely.
There's something you said earlier, I think, was that you quite like things to go on as if it's all normal.
Yes.
And maybe to engage in a complementary therapy means you have to say, actually, something is different.
Yes.
Do you feel a bit?
Yeah. It is, but it's no different than going to the doctors, is it? Or
Absolutely.
something like that. It's just, I'll ring the doctor because I've got a cold, or it's just something. It's another couple of hours or a day that you've got to deal with it. If you've got the time to deal with it, why not deal with it? Why not give it a chance? And like you say, Peter, you're not sure whether it works. I suppose no one will ever know whether it works or not. But if you feel yourself that it's working, it's a win-win situation.
Sometimes it's that connecting the mind and the body, because I think most people start to work out that if they're tense and stressed, they notice in their body that they start to get these aches and pains, and then the question is it my cancer,
Yes.
or is it the fact that I'm
Everything
just
you
actually
get.
tired
Yeah.
and I'm not sleeping, and my body, and then it's almost like the complementary therapies is a bit like a service,
Yes.
with a car, that you're being fine-tuned, and everything's just being rejigged a bit,
Yeah.
help
Yeah.
to realign.
Yeah.
And so some people come to the clinics and they go, I just feel like my body needs a retune.
Yeah.
And so that's
Yeah,
a mechanical way of
exactly
looking at it, but it's a useful
useful tool. Yeah.
Well, Ian and Peter, thank you very much indeed. It's been fascinating to hear both your stories, and I hope you found that interesting, Ian, and maybe
Yes, I
some
did.
food for thought.
Yes,
And
yes.
Peter, thank you very much indeed.
Thank you.
Thank you for listening. We hope you found that podcast interesting and informative. Plan B was created in response to patient and carer requests and is driven by your input. We would love to hear from you if you found the podcast helpful or have suggestions for future podcasts. You can do this by sending an email straight to planbe@christie.nhs.uk. That's planb, PLANBE, at christie.nhs.uk. Find out more about Plan B by visiting our blog. Simply search for Christie PlanBe on Google Blogspot. And finally, if you'd like to register for Plan B, please contact your clinical team at the Christie.